Okay, good morning to all of my dear friends and students. In this session, we are taking a topic of forensic medicine, that is medical ethics. So we start the topic with the definition of medical ethics. So definition is already written on the boards. What is the definition? It is the study of moral principle with the help of code of conduct which guide the medical professional to deal with each other, patient and states. We try to focus in definition two words. What is moral principle and what is the code of conduct? So we start with what is moral principle. Let's see, moral principle means what is right or what is wrong according to the human behavior. Basically, in simple term, moral principle means what is right, what is wrong according to the human behavior. Now, how we decide what is right and what is wrong? So, for this, we use a code of conduct. So, on the basis of code of conduct, we decide which is right or which is wrong. Then with the help of this moral principle and code of conduct, we deal with our calling, patient and their states. So this is the overall definition of the medical ethics. Now after definition of medical ethics, we go for moral principle. What are the moral principles? So basically there are four moral principles. One is autonomy, another is beneficence, third is justice, and the fourth is non-maleficence. So we take one by one. First we start with autonomy. What is autonomy? Autonomy means basically it is a patient having a right to take or refuse the treatments. That's why it is written in patient having a right to accept and refuse the treatment. It includes consent and maintaining the confidentiality. So basically in autonomy there are two things are included. One is consent and another is confidentiality, means maintaining the privacy. So what are the age of taking consent? For any medical examination including rape examination, the consent taking age is 12 years, but for treatment it is 18 years. Now after dealing with autonomy, we go for the second things, beneficence and the justice. Beneficence means doctor tries to help the patient. Beneficence can't include that the doctor help the patient equally. These things are included in justice. In justice, doctor help the patient and equally treat the patient. So there are overlapping between the beneficence and justice. Overall difference is that in case of beneficence, doctor only they help the patient. It not include that doctor treat the patient equally irrespective of his religion and caste and any personal issue. If these things are included, then we can say it comes under justice. Now after dealing with the beneficence and justice, we go for the non-maleficence. Okay, non-maleficence means in common term we can say that we don't harm the patient.